Remember the 70s? Well, if you were practicing medicine, you will painfully remember that malpractice suits were like an open range. No fences, no limits. Malpractice carriers were all from out of state, and when times got rough, they pulled up stakes and went back east. No roots, no commitment. They served Wall Street, not Main Street, Colorado.
Malpractice at that time was a big issue, and it was hard to find insurance.
Our rates were going up very, very rapidly, and we were more concerned because we didn't have a good risk management program. We didn't handle malpractice situations as skillfully as we do now.
They were encouraging many doctors to go ahead and settle frivolous lawsuits because it's simply saved them money.
Raising our rates and wouldn't share any financial information with us whatsoever.
There were questions about the relationship and the nature of the relationship. Commercial company interested in making money and not so much interested in protecting physicians.
Colorado doctors knew that to survive, they needed a malpractice insurer that would stand by them in the bad times. It needed to be homegrown, locally owned. A company by and for physicians, a company that would help them change the legal and political landscape to impose tough laws that assured fairness and predictability. They needed, and built from the ground up, COPIC.
The founding 5 docs who created COPIC, they were all either CMS presidents, former presidents, or president-elects, and they came together and decided that insurance in Colorado ought to be provided by a doctor-controlled company that was more focused on protecting physician interests and not so much interested in making a lot of money.
Allowing the organization to begin to get rolling as a startup company without a proven track record was something that clearly had to be overcome. But I think part of the reason why that actually happened was there was enough ill will that many doctors were willing to give a new company a shot, particularly if they had confidence in the leadership.
This year, 30 years later, we celebrate one of the most remarkable relationships in the history of American medicine. A partnership that has pioneered new trails in patient safety, physician education, and a commitment to community health that is now a model for everybody else. This year, we celebrate our most precious pearl, the partnership of the Colorado Medical Society and COPIC. 30 years serving the physicians and patients of Colorado.
As you know, COPIC came out from the Colorado Medical Society, and COPIC is a physician-centric, physician-driven organization in which we, in essence, surround ourselves with the physician community, and recognizing that the mission of COPIC is to improve medicine in the communities we serve.
I've worked in 20 states and territories from as far east as Georgia and far west as Guam, and I've never seen any insurer that does more for the physician community than COPIC does.
Why are they different? Because they were put in place by docs that said, we're not just going to build another insurance company. We're going to make a difference. We're going to have a plan that is going to improve patient care, help the physicians of Colorado, help the patients of Colorado, and at the same time deal with this malpractice mess that was going on at the time.
It set this state apart from many, many other states in the United States.
And the partnership that's been created around COPIC, I think exceeds anything I've seen around the country.
Something that is homegrown by physicians, for physicians. I mean, it doesn't get any better than that.
Over the decades, CMS and COPIC have partnered to change the legal and regulatory landscape of Colorado and ensure that Coloradoans receive the safest and most honest access to care of any state in America. Nobody defends medicine better than CMS and COPIC, and nobody works harder at it.
Doctors, based on statistics, will get sued.
In COPIC,
The philosophy is defend good medicine.
We see ourselves as being partners with the physicians and the healthcare delivery system, and being partners with them in part means supporting them when they're going through what most of them describe as the worst professional experience in their life.
Any of you that have been sued can relate to the fact that this is extremely stressful, even when you know you haven't done a thing wrong. And COPIC has been aware of that in its insureds, and they have actually set up support groups. And in my case, in one instance, they allowed me to talk to a psychiatrist for a few visits, and that was incredibly helpful.
And one thing I think that really differentiates us from other companies is we think that the very best defense for a physician is that an adverse event does not happen to the patient in the first place.
I really feel like they did everything for me.
Together, we've built a team of nationally recognized experts in education, in legal defense, in practice management, in risk management. COPIC wrote the book on patient safety, authoring the acclaimed 3Rs program. And together, we blaze new trails in the American physician-patient experience.
COPIC endeavors to educate physicians, and that starts at the medical student level and the resident level.
We learned not simply about the ins and outs of the legality of cases, but we also learned very much about how patients can be made whole before a case even goes to trial.
Through their charitable foundations, COPIC and CMS have reached out to promote and support healthcare initiatives across the state. Innovative programs, resident education, student scholarships, protecting our most vulnerable citizens by providing liability coverage to pro bono physicians. And because of these monumental efforts, Colorado patients are arguably the safest in the nation.
Both CMS and COPIC have foundations that provide scholarships to deserving medical students so that they can realize their dream of becoming a doctor.
If the Colorado Medical Society and COPIC are willing to invest in me and I'm worthy of their scholarship, I might really have a good chance of becoming a good doctor.
And I got to sit down with Ted Clark and Steve Rubin and Jerry Lewis Jenkins separately. I got to know them as people. And to hear their own stories and to feel the warmth from them and the understanding of what we had gone through as a family losing Michael, I was blown away. And then to have them try to do their best to help me in any way to do my work, I found friends.
The first thing that always comes to mind with COPIC is what they do for volunteer physicians in our clinics.
Colorado Medical Society and COPIC have really given 9 Health Fair the merit to, for physicians to understand our role in the healthcare sector.
30 years in the making, and yet only a beginning. These are our precious pearls: innovation, caring, wisdom, and a steadfast commitment to the physicians and patients of our state. Everybody touts their good works, but CMS and COPIC, well, together we wrote the book. Please tell us your story. Share your pearls.
Happy anniversary, COPIC and CMS. We're so grateful to be able to partner with you.
Integrity plus innovation equals excellence. That's what I would say.
Just thank you for all you do for us. We can never say it enough, and go COPIC.
I just want to thank you one more time. It really did make a big difference in my life.
Thank you for making the delivery of care easier for all of us, even those of us who are serving a very vulnerable and underserved population.
If I had a bumper sticker that said COPIC Cares, I'd put it on my car.
I'm proud to be part of you.
Not only happy anniversary, but thank you so much.
Happy birthday, COPIC.
CMS and COPIC. It's a story unlike any ever written in organized medicine. It's our story.